Our next gen section predicts what clinical practice might look like in 5 to 10 years' time. In this issue, we look at the status of gene therapy for the treatment of ophthalmic disease. In the previous issue, we did the same thing for stem cell therapy. The signs on both of these frontiers of medicine are promising, and although their introduction has been only 5 to 10 years away for as long as I can remember, this time many of the problems that have stymied the development have appeared to have been overcome. We have even witnessed the first European regulatory approvals for a gene therapy-based treatment. In October 2012, the EMA approved Glybera, a gene therapy that compensates for lipoprotein lipase deficiency. Ironically, once functional gene and stem cell therapies are approved, they may still fall at the biggest and final hurdle, affordability. In some cases, a single application of gene therapy might confer a cure. A cure that's taken decades of eye-wateringly expensive research, development and clinical evaluation to make, and all that has to be paid for and appropriately rewarded. In the case of Glybera, where the market is small, just a few hundred patients worldwide, the per-patient treatment charges may be pitched as high as $1.6 million or 1.25 million euros. In some cases, a single application of gene therapy might confer a cure. It's a cure that's taken decades of eye-wateringly expensive research, development and clinical evaluation to make, and all that has to be paid for and appropriately rewarded. In the case of Glybera, where the market is small, just a few hundred patients worldwide, the per-patient treatment charges may be pitched as high as $1.6 million. The market size for most of the ophthalmic diseases currently under investigation for stem cell and gene therapies is orders of magnitude greater, so per-patient costs might be expected to be orders of magnitude lower, right? Wrong. Market economics tells us that the value of a product is quite simply what people are prepared to pay for it. The question is there a sweet spot? Will there be a price for gene and cell treatments that will be affordable to those who manage healthcare budgets, that will satisfy the companies who have finally realised a promise of a new category of medicine, and that will be palatable to the general public, who will rightly pore over all aspects of stem cell and gene therapy? Getting these negotiations right is going to be crucial. Vision is as precious as its impairment is profoundly disabling. The value of an effective treatment or cure to patients and to society is great. What impact this will have upon the price of these agents once available remains to be seen. Now is the time for ophthalmologists to start thinking about this. What would you be prepared to spend on novel gene therapy agents to improve your sight, to restore sight from blindness? What should our health insurers, whether private or public, be prepared to pay?